I'm here with Adrian Wallace, who's a repeal activist and People Before Profit representative from Carlow. And Adrian, I suppose all of us who were activists in the repeal campaign are delighted and celebrating the fact that we now have abortion services available for us here in Ireland. But it's not exactly like that in Carlow. So can you tell me what the situation is in Carlow at the moment?
So in Carlow is one of the 4 counties across the country where there is no abortion services available. Our constituency is Carlow, Kilkenny, and in Kilkenny there's no doctors are providing the service in Kilkenny City. St Luke's Hospital isn't, and the closest for the 2 areas is in Graignamanagh in Carlow. Now what that means, or in County Wicklow, sorry. Now, so what that means is that very limited bus services, so you will have to there's 2 buses run a day, and you have a 1-hour window in between that slot to try and see a doctor and get your appointment. Now, because of the 3-day waiting period, a woman or a pregnant person is expected to make that journey across 3 different days in a very small window. If you're working, if you have children, if you're in an abusive relationship, it's just impossible. So we still do not have access to abortion services in Carlow, in the vast bulk of Kilkenny, and essentially we vote for healthcare, not for a bus fare.
And just tell me a little bit about why this is happening. What is the reason? Why is abortion services available elsewhere but not in this area?
So there is a number of issues. The first thing you can look at is probably conscientious objection. Now, the World Health Organization have condemned conscientious objection on the basis that it can be a barrier to access and safe abortion. In Italy, where it is prevalent, we've seen a huge abuse of the power here, and doctors actually use their position to coerce women into having or being forced into their pregnancy. So on top of that, this is a medical, we're all for having a tolerant, inclusive society, but if your position, if your opinions, if your subjective beliefs are being used to discriminate against people and against women in particular, then we have a very strong issue with that and a concern about that. In addition to this, we're seeing that it's essentially if repeal kind of really focused on abortion not as a moral issue but as basic healthcare, and if it pushed against that idea that a small group of people could hold us to a conservative agenda, and yet we're seeing with conscientious objection that exact same thing is happening, and it's still affecting women across the country. Because even if you have a doctor in your locality and he's not providing abortion services and he refers to where, because we're seeing that the abortion access is actually very patchy. Problems with car insurance hikes, with public transport, that it's not working, and there's obviously problems with the legislation in that regard. So that's our first issue. Secondly, we find that there's problems with the legislation. The fact that it was an opt-in service instead of an opt-out means that doctors have to kind of put their head above the pulpit. On top of doing that, it also means that it kind of leaves themselves open to protests outside their clinics, because that wasn't included in the legislation. Our concern and our issues is that the government had time to kind of put in features into the legislation that nobody asked for and nobody wanted, like the 3-day waiting period, but they didn't have the time to iron out these type of details that would actually make it accessible and easy for doctors to provide this service. On top of the fact that it's an opt-in instead of opt-out, and that there's no protection for patients or staff in the clinics, in the doctors' surgeries, is that there's no ultrasound machinery available in the southeast. So the HSE have actually privatise that model of care. So it's a private company operating, and they don't operate across the southeast. So we're seeing how the legislation kind of reflects still the conservative elements of the government, and at the same time we're seeing how their privatised model of healthcare has a way of affecting and undermining women's healthcare and access to abortion.
And what would your solution be to this? What would you ask the government to do, or what would you ask healthcare professionals in the area to do?
Well, we are asking, and we have 2 rallies at the end of January, the 26th and the 27th, in Carlow and Kilkenny respectively, and it's going to be a positive campaign. It's encouraging doctors to come out and support women's healthcare and support this sort of drive into the 21st century where abortion is basic healthcare and it's accessible, and we would really appreciate and appealing to them to step out of the mould and kind of bring us forward and offer us that care. So we're doing that locally. We've campaigns, we've online petitions, particularly in St Luke's, because the Catholic Church, St Luke's is the local hospital in Kilkenny, and the Catholic Church are still heavily on the board, and that's a part of an ongoing campaign and will be for a while. So we're calling on the government to really stop and look at the legislation. There is gaps in it. we voted to repeal the 8, we have voted for abortion services in this country. That is still not the case, so your legislation needs to be amended and it needs to be brought, and quickly. We've waited long enough now, so we've run out of patience for this. People are quite angry, to be honest, about the fact that this is still the issue, and there's going to be a lot more campaigning if it doesn't get resolved quickly.